I'm Dr. Kelly Morgan at Trio Natural Medicine, and I'm here with Gretchen. She's getting ready to do her PRP facial, and this will be her second treatment. And tell me, how did you like the first treatment?
I really liked it. I felt like I got immediate results. It didn't hurt. It was really good, and I felt like it helped some of the things that I was trying to get rid of.
Great. And then what are your main skin concerns?
Well, I have some sunspots now. I have enlarged pores, and I've kind of got a little bit of adult acne. And then the other thing is, now that I'm getting a little older, I'm getting the fine lines and wrinkles, and want to try to combat that.
Yeah, great. Well, PRP is perfect treatment for that. So before we get started with the procedure, we're going to start with the numbing cream. So Gretchen's going to apply the numbing cream to her face, and that's going to help desensitize the skin and make the procedure more comfortable. And then we will do the blood draw. Okay, so now we have the numbing cream on Gretchen's face. We're going to leave that on for about 30 minutes. And in the meantime, we're going to go ahead and do the blood draw. Okay, so now we're getting ready to do the blood draw. Dr. Galina is going to draw Gretchen's blood, and we're going to use a small butterfly needle and draw up about 20 cc's of blood, which is a very small amount. So Dr. Galina is getting ready to do that now. And meanwhile, we have the numbing cream on Gretchen's face, so her skin is getting desensitized, and that will make the procedure more comfortable for her. So this is a very quick procedure, just takes a few seconds, and then we'll have the sample, and then we'll get ready to spin it.
This is what the specimen looks like right before we transfer it to a tube and spin it.
Okay, so now Dr. Galina is transferring the blood to the special PRP kit, which we're going to then centrifuge to separate the plasma. And so the great thing about this specific machine, it's a Dr. PRP is the brand. It's a special machine for separating out plasma. And what we do is called a double spin. So we will spin it twice, and what that does is concentrate the platelets. That's the good stuff. That's the part that's rich with growth factors and collagen, and that's what we're going to use in the procedure. Other places use just regular centrifuges, but that doesn't concentrate the platelets as much. So you want the highest concentration possible to really extract those growth factors and all those, the collagen and all the good stuff to get the best results possible.
So now I'm going to press the start button.
Okay, so now we've extracted Gretchen's plasma, and we're getting ready to apply that to her skin. But first we just, so we have here the platelet-rich plasma. So this is what we're going to use to apply to the skin, and then we will send the patient home with the leftover plasma to apply to her face after the procedure. And the procedure involves using this microneedling pen, and so the one that we have is the Bella pen. And we will use sterile needle head, and what that has is 12 sterile microneedles, and that basically will be used to deliver the PRP to the deep layers of the skin to stimulate natural collagen production. And so it kind of sounds like, or feels like a vibration, but you know, with the numbing cream, that really minimizes any discomfort. And so that will be used to deliver the PRP to the skin. The numbing cream has been removed from Gretchen's face, so she's all ready to go. Dr. Galina is going to go ahead and apply the PRP to the skin that the area of the skin that we're going to start with first, which is under the eyes. That's the most sensitive area, so we always start with that first. And it's at the pen is going to be set at the lowest setting. Since it's very thin skin under the eyes, we don't need to go as deep. And you can hear the pen going, it's just a mild vibration. And so we go over each area about 3 to 4 times to make sure that we're getting good coverage. And you may notice some what we call pinpoint bleeding. which is actually a good thing. We want to see redness, we want to see a little bit of pinpoint bleeding, and then we know that we're getting good results and we're getting to the deeper layers of the skin. And the procedure itself is very, there's very little discomfort. I mean, you do feel just a vibration. There's the forehead under the eyes are a little more sensitive than the other areas, and that's why we use a lower setting, and we just start with those areas first, as I mentioned before. So how are you feeling so far, Gretchen?
I don't feel anything really.
Good.
I'm just gonna apply a little more to keep it.
So we keep applying the PRP throughout the treatment, even over the areas that we've already microneedled over, and that keeps the skin hydrated. Okay, so now Dr. Galena has done one side of Gretchen's forehead. You can see that the side that she's already done is red compared to the side that hasn't been microneedled yet. And that redness is what we want. But you may have noticed in other PRP videos from other places that the face looks a lot more red or bloody. And that has to do with the plasma. So if you get red blood cells mixed in with your plasma, you can get a lot more redness, inflammation, and the face may appear more bloody during the treatment. And we actually don't want that. We want some redness, which is good, but we don't want it to look super bloody. But you can definitely see the difference on her forehead. So that redness is really good. So that means we're getting to the PRP to the deeper layers of the skin. And so once Dr. Galena completes the face, we'll also do the neck, and then we will show you what we do afterwards, which is apply a healing serum to the face. Okay, so Dr. Galena just finished with the procedure. So you can see Gretchen's face is red. It looks like a mild sunburn, and the redness usually lasts for a couple of days. But now she's going to apply our healing complex. And so what that is it has organic botanicals, it has 1% hydrocortisone, and that really helps to reduce the inflammation, the redness, and just helps alleviate any discomfort. Because the skin feels really tight afterwards, and this will really help again. And you can have some itching afterwards too. So this will really help, the complex really helps to minimize those side effects. And so we will send the patient home with this little vial of the healing complex, and we have patients apply this twice a day for 3 to 5 days after the procedure, and that will help just speed up the tissue healing and again help reduce the redness and any discomfort after the procedure. And so 2 hours after the patient leaves, we will send them home with the leftover PRP, and they will apply that a couple of hours after the procedure, and then they will again apply the healing complex later that evening. Okay, so Gretchen just had the PRP facial, so this is her face right after the treatment. Obviously you can see the redness. It does look like a mild sunburn. How do you feel?
I feel fine. It kind of just felt like a microdermabrasion. If anybody's had one of those, it wasn't uncomfortable at all.
Good, good. And so the redness will last a couple of days, but we will send you home with this. So that's our healing complex that we give to every patient after the treatment, and that really helps minimize the redness and inflammation. And then we also give these post-care instructions. So this has all the information you need on taking care of your skin after the treatment, and just some reminders like avoiding sun exposure, being very careful about the products you apply to your skin for the next 5 days, because your pores are very open, so you don't want to apply any products that have any type of chemicals or harsh ingredients.
Okay, great.
And then we do recommend, at least 3 treatments and spaced about 4 weeks apart. Great. So stay tuned for our next video, and we're going to talk a little bit more about our BioBeautify facial and some of the benefits that you can experience. And one more thing, we are sending Gretchen home with her leftover plasma. She will apply that to her skin 2 hours after the treatment, and that will just, deliver that extra PRP to her face to stimulate collagen production. And we will see you on video 3.